Hello, everybody. So we are going to go ahead and get started. Again, as always, if you are watching this right now, if you're on with us, I will go ahead and I will enter you in for our training. If you are watching this and it's pre-recorded, you can always email me and let me know that you have watched the full video, as well as if you want to drop a comment down below if you're looking at it from our Facebook page. But I'm going to go ahead and I'm going to let Janna go ahead and introduce herself. And she's going to talk a little bit about her role and what it is they do. And then she's going to start with her presentation.
Okay, thank you. Thank you for inviting me to present today. My name is Janna Shoe. I'm the Outreach Disaster Coordinator for 211 Texas United Way Helpline for the 12 counties of the Coastal Bend region. So my role primarily is finding community resources and information so we can add to our database, attending meetings, events, health fairs, networking, finding out about our community, since I do cover 12 counties, what the issues are community-wide. And then my disaster response is finding out resources for a disaster event, talking about the STEER registry process, which I'm going to do, educating the public about that. And then today I have a separate presentation on hurricane preparedness resources, which are what we provide our own call specialist each May before hurricane season starts, so that we can all be personally prepared to take care of our own needs, our own family, so that way we can be ready for response when we are answering calls for disasters. So I'm going to share my screen and start with the first one. This will come up. So can I get a verbal that you can see that?
Yes.
Okay. So my employer is United Way of Greater Houston. That's who has the contract to answer calls for 211 Texas for our 12 county region. So our agency is in Houston. Our call center is located there. So here's the 12 counties that I'm responsible for service and outreach. And then we like to just always do a review of N11 numbers, which 211 is designated by Federal Communication Commission to be the number for Health and Human Services. Not only is it statewide, it's nationwide. There's also 211 in Canada. So you're familiar with all the other N11 numbers for emergencies, or if you need to dig before you dig for electrical wires, or 711, which deaf or hard of hearing people access for telecommunication relay services. They dial 711, then 211 to access us, or they use their video relay on their own cell phones, which is a service that most of them have. So this is just an example. And then, of course, 988 is for crisis calls, the National Suicide Prevention Lifeline, also the Veteran Suicide Crisis Call Center as well. So our program, 211 Texas, is actually a program of Texas Health and Human Service Commission. So we became a state network in 2004, 5, I believe, was when we last implemented the 25 centers across Texas. So we receive funding from Texas Legislature General Revenue for the cost to provide the 211 service. And then our agencies have a cost share amount of that as well. So you can call us 24 hours a day, 365 days a week, even during disasters, holidays. While our agency is off Wednesday for Juneteenth, our 211 call center is operational, and so is the network. And then there's a toll-free number you see listed below. And so a lot of out-of-state people call needing help or resources, case managers or family members for someone in Texas. And we also all upload our comprehensive database to the 211texas.org website. And the next slide should be the map of the service regions. So this is how we provide service coverage. So you can dial 211. I think if you're in queue after, I want to say up to 2 minutes now, then your call is answered within the network. We use one software. The state provides the cost of the software. And so we actually just switched softwares last year, September 1st, with the state contract. And so this has always been planned if there was a disaster affecting Houston, which is the largest call center, or actually the largest 211 call center in the nation, that the rest of the state can answer calls and help when there is a disaster. So again, it's a 24-hour number. We also have on our website chat, which is in English and Spanish, 24 hours. We have specialists skilled to answer chat. And if someone calls that speaks the language other than what our specialists are skilled for, then we use the language line interpreter service, which is access to over 200 languages. So hopefully 211 is the number you'll call when you don't know who to call or where to start. This is our IVR menu. When you first dial 211, you're given some examples to help you with your service options. Your language option, 1 for English, 2 for Spanish, I think 0s for other languages, which would start that access to language interpreter. And then option 1 is information referral. That's our network. Option 2 is state benefits. So it's your Texas benefits, anything related to state benefits or programs that you need to apply for, update information for. Option 3 is the Office of Inspector General. And that option is for anyone who wants to report any abuse or fraud of a state service, such as Medicaid, a provider, an individual. Option 4 is the State of Texas Emergency Assistance Registry, which we call STEER. And option 5 is mental health or substance abuse. We were written into legislation several years ago, which we already had those resources in our database. And then on our website are options to find those services as well. And then just to give you service hours again, option 1, we answer 24 hours a day. Option 2, your Texas benefits is contracted by Health and Human Services. I believe Maximus is the contractor. So they only answer Monday through Friday, 8 to 6. They are off also on state holidays. After that, it's an automated phone line. It's just a message system. So if someone needs to update information, we encourage them to go to the website. There's also an app that they can download if they need to, update their information for their account. And then again, option 3 is Office of Inspector General. STEER is option 4. And then the mental health or substance abuse information is option 5. So here's our website. You can see, I don't know if you can see it with me talking, but up here is where the chat is, where you would select it. We do need your zip code, just like when you call 211. In order to look up resources, we need to know the zip code to see if there's a city, county, local resource, or a state or a federal program. And then you can also search here by a keyword or a guided search. And then there's a link here to your Texas benefits, which takes you to the state benefit page. So all 25 of the centers are nationally accredited under our information referral standards. Once staff are eligible to take the national certification exam, we do take that. We have requirements under accreditation, how many staff are supposed to be certified. And then I talked about our regional database, which we have inclusion, exclusion. We have some fields that are required in the resource database. We have a taxonomy coding system, is how we code call request. And so for Coastal Bend, we have right now 340 agencies. So that's about 1,291 programs that we can refer callers to. Excuse me. We track our service requests, our referrals, our unmet needs. And we not only do that like for our 12 counties, but statewide, nationwide. And in each year there's a big, it's called 211 count, and Canada participates. And so for the most part, call requests to 211 is what people are looking help for. Is pretty consistent. It might be called something different in Canada or in other parts of the US, but I'm going to show you some call data so you can get a sense of that. And then we do follow up on our calls. We're required to do 10% of follow up on all of our calls. And so we're assessing, first of all, did the help seeker contact the agencies or programs they were referred to? Why or why not? Sometimes they haven't had a chance, or they did contact them, and that were they able to get help? Was the program out of funds, or had they already been helped once during the grant fund year? And then we're evaluating the agency. If we start hearing trends about agencies not answering the phone or someone not providing good customer service, then I will let the executive director know of that nonprofit or agency so they can do some training or coaching with their staff. And then we're evaluating our own 211 service. Would they refer other family or friends to us? And that helps us assess if we need to train our own call specialists or do any coaching on additional information. So I do follow-ups for the Coastal Bend, and they've become quite complicated in the last 2 years. A lot of them still have trouble with getting basic needs met. They may have a medical or health condition, or they're an older adult or someone with disability trying to access service and have complex kind of medical situations, or need indigent health care, those kind of examples. Child care requests, we do follow-ups. We also follow up with any veteran or active duty military family member, service member, to make sure they're getting connected with appropriate resources for them. So statewide, our state database has over 11,000 resources, which include the state of Texas, and federal resources as well, federal programs. So our staff don't just give a phone number. They are assessing the needs with the help seeker, helping them prioritize if someone's calling and they need help with food, rent, utility, several things. They give them a couple of referrals for each request. We try not to overwhelm them. We always tell them to call back because we're here 24 hours a day. They explain an agency's information, eligibility, if they would qualify for assistance, their intake process, their hours, what kind of documents they're going to need for an appointment. So our resources are updated biannually. And then as soon as our resource team makes a change into the database, it's live on the website, 211texas.org. So this is kind of reiterating, we were designated by FCC. The first 211 was in United Way of Atlanta, and the first 211 state system was Connecticut. So we have 3 centers that are 24 hours a day, Houston, San Antonio, and Dallas. And so we take the calls after hours, weekends, or when people are off phones for trainings. But our call center has a contract for 3 regions. So they cover Gulf Coast, Coastal Bend, and the Tarrant County, Fort Worth area. But we we answer 75% of the calls for the rest of the state on nights and weekends. And so our professional call specialists are skilled, they're certified once they're eligible to take the exam. We have multilingual specialists in Houston. I think there's 5 or 6 different languages spoken besides English and Spanish. And then they use the language line interpreter. And again, we're there 24 hours a day. And the main thing about our call specialists, they're very caring, patient individuals, and they help people connect to hope and hopefully some resources to maybe change or impact their life. So our region, as I said, the 12 counties last year, we had about 25,000 connections, of which 16,000 were calls, and then 8,000 were either website searches on 211texas.org or chat or text. And then we still had over 3,000 calls for COVID-19 information, so that we continue to take calls about COVID whenever there's any updates or changes or recommendations or a new vaccine. Still, people might need to go get tested or want an immunization, so we very much still take calls for COVID. So hopefully I gave some examples of how we can help you with connecting people to resources, basic needs, food, rent, utility, electric bill, water bill. We have a lot of calls for transportation, medication assistance, legal issues like renters that have issues with their landlords, health services, free health care or sliding scale fee health care or mental health counseling. We continue to have a lot of calls in our top 10 for mental health related to anxiety for adults and children or youth that are looking for assistance, and substance abuse has requests for help have stayed in our top 10. Calls about older adults for help at home. Maybe they need a provider or Meals on Wheels, or they're a grandparent raising a grandchild and they need caregiver support information, veteran services, and then disaster services. And I'll get into more details about that. So I pulled data for the counties that Brush Country serves. It doesn't have Kennedy County. We need to get that added, but this just kind of gives you an idea from January 1st until June 11th. There's been 176 calls from those counties. So this shows you the map of where the calls, mostly come from. So you can see Alice, Kingsville, Falfurrias, some other towns. And then to the right is like the calls per month. And then here's what callers are requesting. So on the right is the local need request. So you can see of those calls, 42 were for utility assistance. Income support is public benefits. That's actually option 2. So that's transferring them over if they excuse me, if they need Medicaid or food stamps or TANF and asking for a food pantry, our cost specialists, can assess based on their family income, household size, that they probably could qualify for state benefits. So they'll ask, do you want to be transferred to option 2, or do you want to go on their website, or do you want to download their app, or do you want a community partner help you, fill out those applications online? So that's income support is public benefits. Then, as I said, substance use, rent, mortgage, food, aging, medical, mental health, etc. So you see all of the call requests that have come through for those, for y'all's, the counties that Brush Country serves. And then to the left are the agency referrals. So Catholic Charities, they have services in the rural counties. So we refer a lot to those programs. Community Action Corporation of South Texas, we call it KCOST. Texas Health and Human Services Commission, that's option 2. That's any state benefit. And then Department of Housing and Community Affairs is like for rental or landlord or information about housing. Tropical Texas Behavioral Health, because they have resources that cover those counties. Of course, Clayburgh County Human Services. Besides that, and 1 or 2 other agencies, it's very limited referrals for Clayburgh County. And then you see the food bank, and then Real for transportation and other assistance. Synacor Foundation is based in Corpus. It used to be called Charlie's Place. And so that is inpatient detox for drug and alcohol abuse. And so you can see the agencies there all the way down that may cover one of those counties and their services. So typically our top kind of counties, it's always Nueces County, San Patricio County, Jim Wells, Clayburgh, usually in our top 5 like counties of most requested needs come from in a year. So that just kind of gave you an idea of the data. Excuse me, I'm going to take a drink. And then I'm going to move into our role during disaster response. So since we implemented 2005, these are all the events that we've been involved in through 211 Texas as a network. And we right now continue to respond to the survivors for the flooding, the tornadoes, the straight line event in Houston that happened since 2024. I need to add those to the event. So it's a variety of different responses. And so our call specialists, are calm and gather the information and then provide the resources if there's one available for the disaster event. So my job is to find out what's the scope of the event. So like we've already started state weather calls today for the tropical storm weather that's going to come our way this week. Some of the emergency operations centers are starting to activate so that they can have their city crews and everyone ready to prepare to clear out storm drainage, secure equipment, etc. And so you'll probably start seeing more information in the media. I got a press release earlier that Port Aransas has already pulled portable bathrooms and some other stuff off the beach because they're expecting such high tides there. So I would expect at some point the beach access will be closed because it won't be safe to drive there with all the flooding and the water coming up on shore. So that's my job, is to gather information, notify our network in case the whole network may get calls. It depends on the size of the event. And then attend our emergency operations centers to get briefings, any resource information. And then after event, if there's damage, finding out where survivors can report damage or what services will be available. At 211, we probably start getting an increase in steer registrations starting today and tomorrow. And I'll go over that. We get calls about evacuation routes if evacuations are ordered. Shelter information inland, because not everyone can afford to go to a hotel for several nights. And then afterwards, if there's effects of flooding, the VOAD groups that come in, we put all their resource information. So if someone's zip code is affected, they can call us anytime and we can give them resources for the event. And then we participate in long-term recovery, such as Hurricane Harvey, which was about a 6-year process. They ran out of funding last year, so the last homes were rebuilt for the 6 counties that were affected last year in 2017 for Hurricane Harvey. So here is just some more examples. I don't know why it pops back. The first couple are Hurricane Harvey survivors, and then the second one is from some rain events, of course, COVID, and then winter storm. So here's the types of calls that we're getting at the bottom, especially if the power goes out and someone has medical issues, if they're on oxygen or ventilator or need some kind of IV therapy or electric for some service, electric wheelchair, then we get calls for that. And so that just kind of gives you an example. So I'm going to move into STEER, which is a database that is under the Texas Division of Emergency Management. And so the state coordinator is Samantha Fabian, and this is a presentation she gave. We co-presented at our hurricane conference. This is the latest information to share. And so it originally started as a transportation assistance registry. It was just really for the coastal counties if someone needed a ride to get their name registered. And that was after Hurricane Katrina and Rita. And then in 2013, the questions were expanded to ask medical functional needs, pets, if someone had pets. And so it changed names to State of Texas Emergency Assistance Registry. And then more cities across the state said they wanted to use it as data information. So it was changed really, it's all hazards. So you can register your information, even if you don't live in a coastal county, but your area may have tornadoes, may have wildfires, may have other, natural or man-made disasters. So it is a free registry for anyone living in Texas, has questions about disabilities, like I said, functional access needs, or if you lack transportation. And it's a tool. It provides information to local emergency manager planners and responders about the needs of the individuals in their community. So here's a list. As of February, all the counties, pretty much all the counties participate. So they have a data custodian assigned, which is usually the emergency manager, and they log in and they review the information. So I can tell you all along the coastal counties, they are started reviewing their information probably yesterday or today. in preparation of the tropical weather we're going to experience to get an idea of the type of needs people have. And then how the data is used. Sometimes the wireless emergency alert system, which is automatic, those alerts to your cell phone, they can program that in if like it's a national disaster. Local 911 CAD systems, which is their software system. I think City of Kingsville does it like that. They can push out through 911 phone numbers of residents information. Then a lot of them will GIS map it to their city or county. So they have a visual idea of where their registrations are, where people live in their county or city. They use it to plan for evacuations. If there was a voluntary or mandatory evacuation for a hurricane or storm, they contact people, they find out if they still need help evacuating. And then after an event, they use it for search and rescue information. And there was a law passed by the state 2 sessions ago that city or counties have to have a system to do a welfare check after a disaster, especially for vulnerable populations. And so they use their STEER information to satisfy that requirement. Excuse me. So here's an example. This is a flyer. It's available on the website, the steer.tdm.texas.gov. You can register online, but not everyone may have, access to electronics or internet. So you can call 211. We register 24 hours a day. Someone can print out the forms for you online. They're English and Spanish. A lot of home health companies do that and will help fill out the information for someone. But anyone can fill it out. You can help someone complete it. And then each year you do have to register again. They archive the data for 2 years, but people's needs change or they move and have a different address. So you do have to re-register. And getting citizens registered. We do have to tell someone when we register them it is no longer confidential. That is because the information could be shared with first responders or other state agencies during a disaster, especially if they're doing search and rescue or welfare checks. So again, who should register? Someone with disabilities that limits their mobility, people who are medically fragile, maybe someone's insulin dependent diabetic and they've had a below the knee amputation and they use a wheelchair and they have a provider, they have help at home or they go to dialysis. People who have communication barriers, they added a question last year. If you have dementia or Alzheimer's, that would interfere with understanding communications. People who need medical assistance during evacuation or an event, who require personal care at home on a daily basis or who might need transportation. So we encourage everyone to register and register now. Don't wait. There is a point in time where emergency managers are in the process of responding to an event and they're not going to have time to look at your information. So we tell everyone to register beginning of the year. Don't wait until there's a storm, especially one right now that's down low Gulf. But once it starts moving in, your information will not get to emergency managers. There's just not enough time at that point. So you do get a postcard reminder. I think they send it in October, and this is a postcard on the right. So it's a reminder that, hey, you need to re-register beginning January 1st. Options on how you can register. And again, you can register online. Here's the forms. Facilities that are licensed by the state of Texas, like nursing homes, assisted livings, what do they call them now? State supported living centers, they are required to register a facility form, which gives like their patient count so that an emergency manager knows, however many nursing homes are in the county, what's their average patient count, and it requires them to give a contact name and number too for that facility. Oh, I have that duplicated. So there's a postcard. So I'm going to stop that part and see if there's any questions before I go into the hurricane preparedness planning section I have, if anyone has any questions.
One of the questions I had is for the steer, if any of our CASA kids have, like disability, like you said, like sometimes it just depends. Are they allowed to register, like whoever their caregiver? Are they
Yes, we
allowed?
register children.
Okay.
There are a lot of children living in Texas that have full care support at home. They're
Okay.
on ventilators, they have
Yeah.
oxygen, they have vent machines. So yes, we register a lot of children, lot of children that may have uh, IDD, living at home. I've seen a lot that I've registered, not a lot, but like I've seen 4 or 5 that I've done where it was a child on the autism spectrum and then they had other medical issues. Yeah. So
And so when they're like, let's just say a caregiver, they're only registering that child, they don't register themselves per se, right?
well, if they need the help too or have medical needs
Mhm.
themselves, then yes, they should register themselves as well.
As well. But if they don't, is it okay to just register the
Yeah,
child?
yeah.
Yeah.
Home
Okay.
health agencies do that all the time. They register children, teenagers, adults with disabilities living at home, with full care support.
Got it. Thank you.
Okay, gonna move into just some hurricane preparedness information. Oh, wait, oh no, can y'all see that? Need
No.
to, no, I gotta share again. Share. Okay, so
There.
can you see now?
Yes.
Okay. So this is information we give our own staff, and I've been giving out in the community for the last 2 or 3 years. So it's recommended for your own personal preparedness that you have a grab and go bag, which you can see some examples here. And this is literally a grab and go bag. So you should have all this stuff already in it, ready to go, copies of information. Um, right now, you should get your cell phone out, get a piece of paper, write down names and numbers out of your cell phone, because when cell phone towers go down, you're not going to be able to use that if the power's been out and your phone is dead. Family, friends, your doctors, your pediatricians, your insurance agent, bank accounts. I personally have copied all that information and I have it in my plastic bag, my go bag, because you will need to prove your residency. Even if you have a Texas driver's license, if your area is affected after disaster and law enforcement is securing the site and there's a curfew, if you cannot prove besides your driver's license that you live in that house, that apartment, that mobile home, that area, they are not going to let you in. So we all pay our bill. Well, I do. All my bills are deducted from my checking account. So I just printed out my water bill, my electric. I made copies of all my insurances, my bank accounts, my credit union accounts, my social security card, birth certificate. I can tell you, based on many years of working with survivors of a hurricane, these are the things that they did not have prepared and were blown away, never to be found again. And it is a big barrier. If there is a FEMA declaration, you have to provide all this information, income statements, pay stubs. It impedes when you need to go further in the long-term recovery process. If there's a long-term recovery group that can help you with rebuild or repair, you have to provide all this information. So that's why we suggest you start doing it now. Well, actually, you should start in April or May, copying everything, but at least get names and numbers out of your cell phone, family that don't live in the area, so that you can let them know if you're going to evacuate where you're going, so they have a contact. So these are links that you can build a kit, and then don't forget your kids. You see the backpack on the left has like whatever they would need. Think about things that are non-electronic, because again, if the power goes out, the iPads, the phones, not going to be accessible to them, and you might have some cranky kids on your hand. So color books, activities, their stuffies. We recommend having cash. Again, if ATM machines are down, you might need cash to pay for things. So get some cash, have your kids' pediatrician's number or the health clinic, their health insurance cards, your own cards, your vet, you have animals. So there's links here where you can get information. And then we talk about a checklist. So we should all be making our plan. We should all know what routes we would take if we had to leave our home today, if we were told to evacuate. Last week, there was a gas leak in Aransas Pass, and they did not let people into the neighborhood because it was not safe. So it doesn't have to be a hurricane. It could be something as simple as that, a gas leak down your street, and you're not going to get into your neighborhood. So where would you go if you had to leave? Where would you stay? Get your emergency kit ready, stay informed, get to know your neighbors, check on them, especially if they're older adults or have disabilities for evacuations. And then how are you going to get your emergency alerts and warnings? What is your shelter plan or your evacuation plan? And then how will you communicate with family or friends outside of where you live or where you may be going? So again, we say make sure everyone knows important phone numbers. Children know their parents' full names, not just mom or dad, but what their names are, their address, if they're of the age where they can learn their address. Keep a list of contacts, a paper copy by your phone or in your emergency kit. We recommend a solar charger, which doesn't need power. They're pretty inexpensive. You could probably order some on Amazon today and they'll be here tomorrow to charge your mobile phone. You just place it in your window of your car or outside and it charges up and can charge your phone for a couple hours. Find areas in your home where you need to shelter in place in case there is a tornado. Go to your interior, most interior room or wall or area, hallway. Determine the best escape routes from your home. Find 2 ways out of each room. Be sure your kids know how to escape. Practice fire drills. Let them know it's okay to break the glass if they need to get out. Nothing will, they won't get in trouble for that. It's important that kids know, how they should be able to get out of their home. And then decide where your meeting place is outside of your home. So just in case, there was a fire at your house or your street and you had to leave, where's everyone going to meet? So we talk about your go bag. It's just what you take when you need to go. It should be something, portable, either in your vehicle or somewhere by your, close to your bedroom or wherever you would grab it. Then your stay at home kit is, something different. That's when you're going to be there for extended period of time. There's some checklists on here about building your disaster kit or your emergency kit. And here's some ideas as well. Right now they say 1 gallon per person per day, which could be as simple as if you drink your local water, just get a bunch of containers and fill them up, to have the water on hand. You can use it for either, brushing your teeth, bathing, drinking it, non-perishable food, your battery powered or crank radio, flashlight, first aid kit, hygiene items, your face mask, hand sanitizer, local maps, medication, a multi-purpose tool or a hand-operated can opener, copies of personal documents, your cell phone with extra chargers, solar powered charger, extra cash, extra clothes, especially if you're going to a shelter or stay with family or friends, family emergency contact info on paper, a copy. So here's a slide for pets. We don't want to leave them behind. There's some really good information on this link from the ASPCA on caring for your pets, making sure you got their food, a bowl for their water, portable bowl if they take medicines, crate, they need to go in a crate. And then this 311 really only applies to Corpus, has a 311. But of course, 911 for emergency, 311, for city services or your local city or county office number if you need to report any debris or flooding or traffic signals are down. And then, of course, 211, we provide information for disaster services, relief and recovery, and then we register people and steer. So here's local emergency notification systems. If a county is not listed here, then they don't have one. or they have their own systems such as reverse 911, and you have to contact that city to sign up. But Nueces County has reverse alert. Aransas, Refugio, and Sampat all use code red. B County uses iInfo. And then Jim Wells, Live Oak, and Brooks all use HyperReach. So here's links where you could click on here, create your account, and sign up for the alerts. And then if you live in Corpus, on this Corpus Christi website, there is a evacuation map and route. It shows based on storm surge or who they always recommend evacuate first, which is Port Aransas, the island, zip codes that would be affected by storm surge. And then there's a text dot evacuation route. So you can, if you can, avoid IH-37, because if evacuations are ordered for city of Corpus, Nueces County, there's going to be hundreds of thousands of people driving on IH-30 to try and get, to San Antonio or wherever they're going. So if you can take back roads, county roads, and avoid IH-37, it's still going to be a long process probably, but at least it might not take as long. And then on the back of your, okay, so statewide highway conditions, that's a text dot number you can call. I think it's open 8 to 5. It's their call center. Yeah, text dot road conditions. You can go on Drive Texas or call their number. They do update it throughout the day, tells you what roads are closed or flooded, etc. And then if you're ever a stranded motorist on a road, on the back of your Texas driver's license or ID is a very small print toll-free number. And you can call if you need help or assistance. DPS may respond if you're on the interstate or a county road. It might be the sheriff. And so they will come see, what's wrong, if your car's disabled or stranded. If you need a tow truck, they will call one, but it's not free. You will be responsible for the tow truck fees. And it's not really used for 911, but, if your car breaks down somewhere and you need assistance, you can call that number. And then we recommend downloading the FEMA app. There's a lot of resource information you can order there as well to give out to family, friends, community. The Red Cross app is really good, has a checklist, hurricane safety checklist. It has a way to let you know that you're okay. You can also get local shelter information. Excuse me. And then this is just types of flood insurance. There's homeowners, renters, windstorm, and then the flood insurance, National Flood Insurance Program. You want to find out if you live in a flood zone, you can go on the website and put your address in. It'll tell you what the flooding history is for that zip code. That address lets you know if you're in a 100-year floodplain, 500-year, etc. And then here's just a bunch of connections to resources that I've vetted and verified. So just to kind of, recap, if you want to find out what your city or county is going to do, you can always search the website. It's usually under emergency management. It's usually with the fire department or police department. It just depends on the city or county. And then if you need to sign up for an alert that wasn't on the list, you can call the city or county and ask them what they have, if they have anything. So this is just more information about going to a shelter. So this is what it looks like before. You can see the mats are not very thick. That's what you would be sleeping on if you go. Here's some ideas of things to take to a shelter. And then here's the reality of a shelter. They are available inland, San Antonio, Austin, Dallas, different communities, free to stay at, but it will be very noisy. There'll be lots of people there. They do give meals and snacks. If you take your pet, you're still responsible for your pet's care. So this is kind of like what to expect in a population shelter. And then if you return after a hurricane, some tips, and I'll share this presentation with you. And then we talk a lot about with our staff self-care, because our staff, we answer calls 24 hours a day during disasters too. So it's just only natural after a while of doing that for 10, 12, 13 days in a row, you kind of get burned out and you have less compassion because when you're answering 100 calls each shift for like that amount of time, just normally happens. We're human. And so we just want to make sure everyone understands compassion fatigue. And here's some symptoms of burnout. That could be any day with your job, just feeling those symptoms. You might want to check with your employee assistance plan benefit if you have one with your insurance for counseling sessions. Ours gives 5 free sessions per situation, I think it's called. And then there's Red Cross mental health volunteers, the local MHMRA, which is Coastal Plains Community Center, local counseling services we have in our database. There's also a regional crisis incident stress management team that can come out. So that's just some more information, how you can reach us at 211. And I'll come back to y'all. Let me stop sharing. Just see if there's any other questions, and I'll provide these slides as well.
Yeah, no, I think I mean, I wrote down a lot. I'm like just more for myself as well. I think this is
Yeah.
a great, but really for some of our volunteers, right? Because we are in hurricane season, we
Mm-hmm.
are, so that the hurricane part of things is just our volunteers being able to educate for the advocacy of like know what to do, know you have a plan, and then just for
Right.
foster parents or anybody to reach out to
Mm-hmm.
our organization, but also saying, hey, like we can't help you, but if you were to reach out to this organization, you can call 211, things like that. Just giving them those resources so that way they know.
Mm-hmm.
And then even our parents, like after they're no longer with us, I mean, it's just good information for them, for us to pass on to them to let them know that there's those resources. So
Yes.
thank you for allowing to speak to us today and educating us a little bit more on 211 as well as being hurricane ready. So I know I'm going to take
Good.
some of this information today, and I so often you hear about like making sure you have like a bag so that way if for whatever and
Mm-hmm.
I feel like some people don't think about it, and I think they get it off at times, but it just depends, like weather's so unpredictable that it can change in like any split second. So just being able to have something like that. So that's definitely something that I think I took away from this. But
Mm-hmm. There's
I
lots
can't.
of natural and man-made disasters in our world. So you have to be aware. You have to know what's going on in your surroundings, and you have to be ready to react and to leave if if you're told to leave where you live,
Yeah,
or to
definitely.
shelter in place if they tell you to do that. Mm-hmm.
Yeah. But I mean, I didn't have any questions. I think yeah, if you could share, because you did have a lot of links that I know might be a little bit helpful to our volunteers to help pass that on. So if you would like to share the presentation with me, and I can send it out just for them to
Okay.
have. But thank
Okay,
you so
great.
much again, Jana, for
You're welcome.
doing this. But I'll see you soon.
Okay, thank
Okay,
you.
thank
Bye
you.
bye.